Hello, I'm Dr. Senator Ron Stollings. I represent the 7th Senatorial District. That's Boone, Logan, Lincoln, parts of Mingo and Wayne counties. Until this past redistricting, now it's Boone, Logan, Lincoln, and Southern Kanawha County. I've been in the Senate for 16 years. My day job is that I'm an adult medicine specialist, internal medicine. For 10 years, I had added qualifications in geriatrics. I want to talk a little bit about PEIA and specifically Senate Bill 574. PEIA has about 200,000 insured public employees in West Virginia. Of that 200,000 there's about 30,000 that are in what's called the non-state mandated pool. Those are county and municipality employees. For example, Boone and Logan counties has their emergency medical services through this PEIA pool. So does the public health employees, deputy sheriffs, and so there's it makes about 13% of the insureds, and Senate Bill 574 basically raises those premiums on the 13% in order to try to increase funding for hospital services. Now, first of all, let me tell you that the largest number of insureds in West Virginia, my understanding, is Medicare, followed by Medicaid, followed by PEIA. And the private market in West Virginia is fairly small, which is a problem, because the private insurances tend to pay more than government insurances. So that's where we are. We have a large government pay group of patients here in West Virginia. And so kind of the gold standard as to how they monitor or tell you how much you pay is whether you pay to the Medicare limit. Now, most people would say that Medicare doesn't pay for the full cost of care, but they come closer to it than any of the other government payers. So in general, Medicaid pays sometimes around 60, 70, 80% of Medicare, and then that puts them clearly not paying for the full cost of care. And then PEIA is less than Medicaid. So clearly something needs to be done. Again, we're talking about hospital reimbursements, and they are very low for PEIA. So how does that impact hospitals? Well, you're trying to hire nurses. You're having to pay more for nurses. You can't do that if you're not being reimbursed to the point to cover the cost of care. So it's a real issue. Granted, I'm all for raising hospital reimbursement rates. But this Senate Bill 574, first of all, only targets 13% of the insureds. And these 13% of insureds are frequently the least likely to be able to afford higher premiums. Again, public health employees. We cut their budgets 25% some 3 years ago, and we haven't picked that up even during the pandemic. The EMS workers, that's a very fragile workforce right now. They're burnt out, they're crispy, they're going into COVID patients and taking them out, they've been infected by COVID, and we're getting ready to raise their insurance rates and out-of-pocket cost for insurance. And again, with all the inflation, the retirees that are they're retired, but they're not quite Medicare eligible yet, okay? They would have to pay more out of pocket. So it's just, in my mind, a bad bill. So how do you fix it? So if you're getting ready to if you understand that reimbursement rates, to hospitals from PEIA is a problem, and it is, and we need to fix it. We don't want any more hospitals to close, like Wheeling, Williamson, in Marion County, Fairmont. We don't want any other hospitals to close. and we're paying well below the cost to deliver the care. So what do we do? Well, you look at these big health cost drivers. The number one health cost driver is tobacco use. The number two health cost driver is obesity. And I know this. I've been a physician for 37 years now. So I understand when my patients come in and they're overweight, they smoke, they're going to be using a lot more healthcare dollars than if they're in good shape, exercise regularly, and control their risk factors. So we know that a soda tax, could help fund these reimbursement rates to hospitals. So I have a bill that's coming up that basically puts a nickel tax on soda. All right? Now, again, drinking soda, about 12 to 15 teaspoons of sugar per container, that increases your risk of obesity. It increases your risk of diabetes. If you're obese, it increases your risk of arthritis, cardiovascular disease, etc. Now, they've done studies, and a nickel tax on soda would not really change consumption. If you really wanted to change consumption, there's ways you can do it. A penny an ounce and things like that. What I'm trying to do, at least temporarily, again, and if we're going to try to raise rates on EMS and retirees with no cost of living adjustment, and these people that can ill afford it, public health workers, deputy sheriff workers, then we're desperate, right? We're desperate if we're going to do that. 574 does that. And so my bill with that nickel tax would raise about $70 million, which is about 10 times more than what the added cost to these workers that could ill afford it, county and municipality workers. So I can raise around $70 million a year and dedicate that to hospital reimbursement rates. It creates a fund, then out of that fund goes to increasing hospital reimbursement rates. The people that are paying for it are people that are drinking more soda. If you drink more soda, your healthcare costs are going up. I know that the soft drink industry and lobby will jump stiff-legged. It will not impact consumption, I'm quite sure. I wish it did, but it won't. And again, this helps lower the cost for everybody if you did lower your consumption. So the folks that use tobacco, folks that are overweight or obese, drive up healthcare costs for everyone because it's a risk pool. Insurance is a risk pool. So again, this is I think a fair way to try to help these hospitals. It brings in 10 times or 70 million as opposed to 7 million for the ability to try to raise hospital reimbursement rates. I hope it gets legs and runs. I doubt it will, frankly. But at the same time, I think this Senate Bill 574 is not going to do much. It's going to raise $7 million, but it's going to raise it on the backs of people who can ill afford it and who already are a very fragile system, workforce system in emergency medical services, public health, deputy sheriffs, and again, these counties have been hit hard also, and municipalities. So I hope, one, we can defeat Senate Bill 574, and then two, I hope we'll take up my bill that will be coming up on the floor here either today or tomorrow, and then try to raise some money via, I think, a fair mechanism and help these hospital reimbursement rates so they can keep nurses hired, keep floors open, so we don't have to divert these patients to other hospitals away from their communities. I'll be glad to take any questions or anything, but that's just my thoughts, and that's it. Thank you.
Can you ask people that were with us on Zoom to put them in the chat?
Yeah, so if you're with us on Zoom, if you have a question, put it in the chat and we'll try to answer it. How do you stop corporate greed? Well, the rich have gotten richer and the poor have gotten poorer. That's all I can comment on.
Nothing in the chat yet.
I guess I could comment a little bit that it seems like the majority is so focused on creating a large surplus. And this surplus, in my mind, is kind of a pseudo surplus, if you would. We have a lot of agencies that are underfunded. We have a lot of state workers who are underpaid to the point where you can't fill, for example, DEP inspectors, well inspectors, et cetera. So the idea that we have this huge surplus and yet so many unmet needs, if you look at child welfare and you know, all the other foster care and CPS, Child Protective Services issues that we have in the state of West Virginia. My understanding, I think, is that these premiums may go up. It depends on what the negotiated rate is with the hospitals. So if they negotiate up to over the Medicare reimbursement rates, it would be more. The point is, raising premiums on a very small portion of insureds is not going to raise you much money. So I'm not sure if it's a 5% or what rate, but if you're talking about $30 to $50 a month, that's still $30 or $50 a month in a time of great inflation.
We have a question.
Okay.
Senator, do you have any support from any other senators at this time?
I have spoken with the health chairman. He says it makes sense that it does. It would impact the risk pool and help lower rates it's ultimately for everyone. He also wants to have a bill or resolution that looks at all the PEIA reimbursement rates, compare them to the Medicare rates, so that we have information going forward. We have had, as you all know, in 2018, a huge PEIA statewide tour, and there's several recommendations with regard to that. We know that if we if the state puts in more money, then the 80-20 rule kicks in, and so do the insureds, their rates go up too. We put in, if you all remember, about 3 years ago, the governor put in $105 million. We're going to get into that this year, and up to the tune, I don't know how much. I think Mr. Hott said the tune of maybe $25 million. Next year we'll be getting into that too. That's the surplus, if you would, so that it smoothed it out. But basically, it did kick the can down the road so that we don't have to come up with another funding stream or something like that. It's just to get 2 or 3 years behind you and let the next administration deal with it.
With the bill you're introducing help retired teachers? So many of them have not had a cost of living increase for years.
That's a huge issue. Their buying power has gone way down over the years. So this bill, frankly, all it does really, my bill with the soda tax, would only help hospital reimbursement rates. It would not lower or increase premiums to the insured.
Now with this soda tax, you are hoping to at least incentivize people to maybe decide on a better, healthier lifestyle, correct?
Again, there's studies that show if you raise a consumption tax, if you would, up to a certain level, that it does impact. I don't think a nickel's going to do much. It was a compromise. It was a step forward this year because we must be in such a dire straits that we're going to raise premiums on a tiny segment of the population that could ill afford premium increases. But yeah, down the road, if you wanted to do a consumption tax, we've seen those before, I've seen them, and you could dramatically lower soft drink usage. This bill really isn't for that, although I wish it would be a side effect. So I don't think the lobby, the soft drink lobby, should be worried too much about this. I don't think it's going to impact consumption.
That's it for the chat.
Okay, well, thank you all very much, and stay tuned. We'll see what happens. Thanks.